Should I start?
Yes, doctor. So you may start.
Okay. Have you started the timer? Yeah. Shall I go?
Yes, you may start.
Okay. Hello. Hi. My name is Dr. Harris. Can I confirm your identity?
I'm Jenny Cruz. I'm the sister of Mr. Robert Cruz.
All right. Hello. Hi. I'm here to talk to you about certain things. Do you have any idea what we're going to talk about today?
Of course, it has to be my brother. He's in a lot of pain. I mean, I have been in a hospital before, but this is a different kind of pain that he has been having. And moreover, he has been passing this blood through his bowel. And I don't know whether you have done anything yet to stop it.
Okay. All right. Okay. All right. Have they informed you about any of the procedures or the things that we have done so far?
Procedures, doctor, I mean, that's weird. I mean, previously we have talked over this with the consultant several times. I wanted to do surgery for him as if the bowels could be removed, those which has got the cancer. But they've told me each time that, you know, he has reached a stage which is quite advanced and no further treatment would actually help him. So why are we talking about the procedure here today?
Okay, all right. I can imagine that you are in a lot of distress because of the condition, isn't it? So I could totally understand where you're coming from. So I'm here to explain to you what we have done for him so far and what we're going to do and what is the reason that we haven't performed the surgery on him. So the thing is, you know, that he has had a cancer, isn't it, of the tummy. That when we looked at it, it was like that the cancer was spread throughout the abdomen. It was not in like one part of the tummy that we could remove the cancer. So when the surgeons actually had a look at it, they said that because it's spread all over, it would be very difficult to remove the part of the tummy that you were referring to. However, we have certain other options and we have done certain other things that we can do for him. Do you follow me until now?
Yes, I'm trying to follow you. Yes, doctor, I'm following you.
Oh, okay, good. Yeah, so what we've done, because he had this cancer in the tummy and he came in with some blood coming out of the back passage today, because he was losing a lot of blood, we have given him about 10 units of blood just to make up for the loss that he have had already. Does it make sense up till now? Yeah,
it makes sense.
Good.
Yes.
Okay. So furthermore, when we try to, you know, operate, because like I mentioned, it's spread all over, it is very difficult for us to remove it, you know, remove the part of the tummy where the cancer has spread. So
I mean, you tried to operate on him?
So we've looked into that option, you know, but it was not, you know, suitable because the cancer was spread all over. Okay.
Yeah, I know that. I mean, that has been decided when the cancer was discovered.
Yes, exactly.
But I learned from my, you know, brother that he had a camera pass through his back passage.
Yes. Okay. I'm coming to it. Yeah. So when we passed the camera test, you know, when we did a camera from the back passage to try to stop the blood, you know, where the blood is coming from, we were unable to do that because we couldn't find the source where the blood is coming from the camera. Okay, so we have another option which I wanted to speak to you about, how we can stop that bleeding. Does it make sense up till now?
Yes, it's making sense. So you have to, like, you tried to insert a camera and you have looked inside him. And now you do some other procedure. I mean, do you need to redo this camera test again?
No, so we don't need to redo the camera test. We have another procedure, which is called chemoembolization. Do not bother with the term. What it means is that, you know, the blood comes from a vessel, from a channel. In a vessel is a channel that carries blood, and we will block the channel that supplies blood to that part of the tummy. So once we block that channel, the blood will stop bleeding. Does it make sense?
Yes, it does. But don't you have any, like, I mean, don't you have any medication to give him, like, that can stop the bleed?
Yes. So, you know, there are certain medications which can be used to stop bleeding in other, you know, other indications. But because this is coming from a tummy channel, there are no licensed medication that could be given to to stop that. But it's a sort of injection that we're going to use when we're going to go into the channel that is bleeding, and it's kind of a modified medication, but it's not like something oral or something we can give from the arms or vessels that we can give. It's through that procedure that we will go into that channel and we will block that channel with a modified medication. Does it make sense?
All right. Now I get, though it makes some sense, but I'm not getting a bigger picture here. So,
okay.
I mean, what you're trying to mean is that you wish to do a procedure on my brother, isn't it?
Yes.
And is it like a surgery, or it's as simple as the camera test?
So it is a kind of, I would say it's a modified type of a camera test, but in this type of type of surgery, we go into the channels, and our radiologist, the X-ray, those who deal with the X-rays, will be looking at the channels on a computer, and they would go in and they will block the channel. It's not like opening the tummy and going into the tummy, and it's not like a big surgery. It's we call them interventional surgeries, in which we go into the channels, looking at the X-rays on the camera, and those help us to guide where the channel is and which channel is bleeding, and that could be stopped.
But doctor, I mean, is it a pain-free procedure?
Yes. So what we do is we sedate the patient. Sedate means that they won't feel the pain. We'll give them some injections that would make them sedated, and they won't feel the pain at that particular moment. So it's a totally pain-free procedure. Yes.
All right. So, I mean, that sounds okay. It's totally pain-free, because I cannot bear this anymore. I've been listening, and I'm tired of Robert crying. I mean, he has been crying loud since we brought him here, and I think you should be giving him more painkillers. I mean, if you have them with you, then why you're not giving them yet? Because he's in a lot of pain. He has been crying all morning, doctor, and the camera test was not comfortable at all. I mean, right after it, he has started crying more.
I'm really sorry to hear what you have been through and what Robert has been through, and I can well imagine, all the distress and all the frustration that have been there. But what we can do is we can review his painkillers. Okay, we can also review his pain, and we can also ask one of our colleagues, the pain team, to come and see him. There are certain other colleagues that could help us to help control his pain. They're called the palliative team that has already been seeing him.
No, I know your palliative team. I mean, they have, like your cancer doctor have told us that before, and he has been getting this palliative care for the last 4 weeks. Still, the pain isn't under control. So I think you should be giving him more morphine. And when it was given at the beginning, he was a bit comfortable and he could sleep for just a few days. Then again, everything went back to how it was. So perhaps you should give him more morphine.
Okay. So with regards to, you mentioned morphine, we can always give more morphine, but the problem with the downside with the morphine is that it can affect the patient's breathing as well. So if we suddenly give a large quantity of morphine, it can, affect the breathing of the patient, and they could struggle to breathe as well. So what we usually do is we use a stepwise approach. We go up the ladder step by step, whilst controlling his pain, and that is where our colleagues, the pain team and the palliative team, comes in, and we also review the patient ourselves. And I will also discuss this with my consultant, that whether we can review Robert's pain, and we can perhaps increase the dose, or maybe we can start another painkiller which is stronger than, or we can perhaps use something called a syringe driver. These are all the options in which we give the painkillers to the tummy. So these are certain things that we can, explore going forward with his pain. Does it make sense up till now?
Yes, it does make sense, and I'm looking forward to it. We cannot take it anymore. We have been through a lot, and Robert, he's in a lot of pain. And I wanted to ask you something, though I don't
Of
know if it
course.
sounds right to you. It's like, how much time has Robert got? I mean, with him bleeding out and
Hmm.
with all that he has been suffering from. I mean,
Hmm.
we just want him to die peacefully, just have a
Hmm.
good sleep and never rise up again.
Hmm.
Because
Okay.
we don't want to see him with the same torment. I mean, what he's going through, it's a lot of pain. There's
Hmm.
no meaning of it living this life. So, I mean, some extra
Hmm.
shots of morphine put him to sleep, and
Hmm.
he would
Hmm.
just pass away. How about that?
Hmm. I'm really sorry what you're going through, and I'm really sorry that how you feel about it. You know, we are all here to help you as a team and to help Robert to get through this if he can, and what are the steps that could make him more comfortable. And we can explore all of these things. But we as doctors, we do not actually, cannot give someone something that could put him to sleep, and that's not ethical in terms of our training, that we have not been trained in terms of that we can give someone morphine and then the patients can die, or things like that is not our part of, that is not ethical in terms of our training. However, like I mentioned before, we can actually look at it into the pain. How can we get on top of the pain by giving him more painkillers after the review from my colleagues as well as myself and my consultant? And I can well imagine where all of what you're feeling at the moment, and we can help you and Robert into this. Has he mentioned how he wants to spend, like the other question that you asked, sorry, asked that how much time he has? It depends on the success of the procedure that we're going to do on him, that whether we are able to
We have 2 minutes
stop.
left.
Okay.
So,
It's depend.
doctor, the
Sorry.
procedure that you just discussed with me, is it going to
Mhm.
prolong his life?
I cannot, it's very difficult to say that what can prolong Robert's life. However,
I mean,
we are
you seem
treating.
very sure that it's going to be successful, and I hope that it's going to prolong his life, isn't it?
Uh, it's I would like to rephrase if it's a miscommunication. What I want to say was that we'll try to stop the bleeding, and if we are able to stop the bleeding, then we will able to reassess how much it will help Robert going forward. But it all depends on how what is the outcome of the procedure and how he recovers from that. These are the things that still needs to be ascertained going forward, but it all depends on how the procedure goes. Does it make sense up till now?
All right.
Okay. Can you summarize? Sorry, do you have any further concerns, any further questions that you want to ask me?
No, it's just striking my mind. Like all
Hmm.
this time, we have asked for so many procedures, but every time it was a no. Now you
Hmm.
are going for this procedure, so I'm just wondering, like, whether this is going to make him more miserable than he was before, or like you
Hmm.
say, that maybe we can have something good out of it.
Hmm.
Okay, so the chances, okay, like you mentioned that now maybe if it doesn't go right, he's not going back to the same. So I will still
Hmm.
insist on, I mean, perhaps this procedure is completely unnecessary, perhaps.
Hmm. Okay.
So
Yeah, I can.
is
Sorry.
there
Yeah.
any
Go
way
on.
that I can deny this procedure?
The thing is that because this Robert has been reviewed by the surgeons, and we have different modalities of treatment at different time of patients,
Your
symptoms and
time's
all.
up, but I'm giving you extra 20 seconds.
Okay. We have different treatment options that are offered to the patient at different time of presentation and what symptoms they have. And our surgeon colleagues think that this is the right moment to do this procedure. And we cannot totally, tell how much it's gonna, help Robert going forward. But it all depends on how much he, recovers. And given the fact that you have asked me that, can you deny
now
it?
your time's up. Now your time's
Sorry.
up.
Okay, thank you.
Right. So you have 40 seconds to get up your mind. All right, doctor. So how did the conversation go with the sister today?
So I think it was a bit tricky and a bit difficult situation, obviously, because the sister was upset with all what's been going through with Robert. And I think the part is because the cancer is palliative, and it's very difficult, So the conversation was a bit tricky. But I think there was some miscommunication in the past as well regarding what sort of treatment options could have been offered to Robert in the past. So those were the certain things that she was concerned about. She was also concerned about the outcome of the operation and all the situation. So I think all in all, I tried to explain the procedure and what we are expecting. She was also very concerned about the pain control. So I tried to, explain that what options we can have and how can we.
So coming back to the pain, you're saying that's a totally painless procedure. Is it so?
So if we use the sedation, I think the patient would only feel the pressure of when we go into the vessel. I'm not sure about how much pain the patient would feel. Yeah, I'm not entirely sure about that.
All right. So for such a procedure, does it carry any risk?
Obviously, like any operation that would carry any procedure, this would also carry risks of obviously if they are not able to secure the bleeding. So the risk of failure is always there, and there are always chances of getting infections and then any further bleeding if there is any complication during the procedure. So yeah, so these are certain things that could happen whilst she's having the procedure.
So do you think that you could have discussed some of the risks which are involved with this procedure? The way you described it sounded like, it's a totally risk-free procedure. It's completely painless. And, she thought, that's what she thought. And that's why she agreed to your plan. Okay. So what if you'd have told her that it does carry some risk and it's not totally pain-free, and if she would have thought otherwise, then what are you going to do? Are you going to still go ahead with the procedure?
So obviously, I think, I should have explained, but I think she was also concerned about certain other things that were raised during the conversation, but I should have actually should be able to manage and squeeze in these complications so that, she has a better understanding of the thing. But I'm unsure about Robert's capacity and his advanced directives or any lasting power of attorney. If the sister has all of those, then only then we will be able to decide whether she can. If he doesn't have the capacity, then and I would also like to check the lasting power of attorney. And if she has that, then obviously yes, she can refuse the procedure. But it all depends on how Robert is, what's his mental capacity, and what advanced directives or lasting power of attorney do we have in this situation.
So do you think this is a life-saving procedure?
It is not a life-saving procedure. It's to control the bleeding and whether we can get out. It's not a life-saving procedure in all totality now.
All right. Okay. So in case if, let's say at this moment, Robert is alert and he's lucid now. Okay. So if he wants to go for it, you go for it. But let's say at any point he's getting confused, okay? Then of course you have to go to the sister and you have to ask the power of attorney or whether he has left any wishes in advance. Okay, so you need that perhaps. All right. So now could you please describe the procedure for us in layman's term?
Sorry, with what procedure?
The transarterial embolization.
Okay, so yeah, it's basically it's the interventional radiologist go into the arteries and they try to inject certain substances to try to, you know, stop the bleeding from the artery itself. Yeah, so yeah, that's how this procedure is performed.
Right. So there was a point where the patient asked you for assisted death and you strongly denied.
Yes.
Right. So why did you, react the way you did?
I just try to explain the ethical principles behind the assisted death and the common law that we have in the UK for assisted death, and I try to explain her that it's not in our ethical understanding that we provide assisted death to the patient. So that's why I try to explain that to her, that we don't provide assisted death to the patients.
All right. So if there were any legal issues here, what would be the most important legal issue in place?
So the legal issues would be capacity of the patient. That would be very important in this scenario. Then obviously the Mental Capacity Act, which including lasting power of attorneys, advanced directives, would be really important. Patient's autonomy would be very important as long as he's lucid. And beneficence would be important because what we're trying to be in his best interest, just trying to stop the bleeding.
Okay. So lastly, are you aware about anything called doctrine of double effect?
Sorry, am I aware of what?
Do you know anything about doctrine of double effect?
No, I'm sorry. No,
all right.
Not aware.
Okay. Thank you, Dr.
Thanks.
All right. Good try. So let's go back to the case. So for those who have joined, and the chat box is open now. All right. So first of all, this is a case which there's a chance that this might show up because this was a type 3 case in the last 3 type 3s. Okay. And when it came first, perhaps, the first time, anyone would struggle a bit describing this procedure if they are not acquainted with how it's done. Okay. So if it's totally new, then you might have some difficulty describing the procedure. But remember, for any procedure, whatever it is, okay, you can always describe just in general, and you don't always need the specifics. But you should always remember that when you describe a procedure, you should always mention about the consent that you need to go for this procedure, and just discuss a bit about the risk and what could be the outcome like. Okay, and the purpose of the procedure should be very clear. And for any reason, if the patient you are to do the procedure on, for some reason, if the patient can get unconscious or might lose the capacity, you should also take an account of the persons who can be responsible to give you the consent. That means whether the patient has left any power of attorneys or an advanced directive, especially if the patient is like this, who has an advanced cancer. Okay. So in this scenario, first of all, this is the first time I'm doing a case with Dr. Harris. So perhaps what I noted that you have a tendency at times to use some jargons, though you try to overcome them by explaining them later, like certain terms like abdomen. Okay. These are, very tempting. Okay. That you every day we use those terms, but you have to be a bit careful regarding that. But sometimes some examiners might overlook 1 or 2 jargons, but if there are more, Okay, even there, some examiners are very strict. They wouldn't even tolerate a single jargon even. Okay, so I don't mean to say to you that you can allow jargon. So jargon should be totally avoided wherever possible. And whenever we are to start a scenario like this, we can always ask if you are the next of kin to whomever you're talking to. It could be the sister, it could be the daughter, it could be the mother, whoever it is. Okay, you should always ask about the next of kin, because some examiners would want you to ask that. Okay, so first of all, whenever we reach this sort of cases, okay, we have our approach. Okay, and the approach is we always look for our role, then we look at the patient's particulars and whom we're talking to. And whenever we notice that you're talking with the patient's sister, that means you're talking with a relative, we ask this question: what happened to our patient? Whether he has lost the capacity or whether he's asking us to talk with his sister. So we look for the C's, and C's are all the legal issues. So here, first thing we have to always check whether the diagnosis in place is confirmed. Okay, whatever we are trying to do, whether it's a confirmed diagnosis, and we are doing this for the diagnosis, and whether our patient has the capacity. Okay, so this we can discover once we give it a read. So patient has a disseminated colon cancer, is on palliative care for the last 4 weeks. So patient has an advanced cancer and already been on palliative care for the last 4 weeks. Okay, he has presented today in the A&E with profuse bleeding per rectum. He has urgently given 10 units of blood, and colonoscopy was done. So he was given blood, and furthermore, the camera test was done by the medical team, but they were unsuccessful to stop the bleed. Now, the consultant has decided to do transarterial chemoembolization, which is a procedure which has been decided by a consultant. And at this moment, Mr. Robert, I corrected this, it was written previously wrong, and he is alert and lucid now. And patient sister has come to you to talk to the medical team about what has been happening with the brother. Okay, so your task, always number your task. You have to discuss this current situation with the patient sister, and you have to also discuss the further management plan, which includes this procedure which you have to do. And this procedure also you have to discuss with Mr. Robert, of course, later, because you need a consent for that, right? Now, so what we know, our patient, it's a confirmed diagnosis, he has a cancer, and our patient also has the capacity. Okay, so usually for people who have the capacity, we do not need to explore whether there's a power of attorney or advanced directive. But still, in some cases, if you're talking about someone who could have progressive dementia or where the consciousness can be impaired at any time, okay, like our patient is in an advanced state, anytime his consciousness can be impaired. He's lucid now, he's alert because we have given him 10 units of blood, but perhaps he can go into shock again and maybe he will be confused. So that's why here you have to explore whether he has left any power of attorney or advanced directive. Okay, you can talk about it. It might be raised or you might skip it, but you have to keep in mind you might need to touch it, especially when the sister is going to tell you that, no, I object this procedure, you cannot do it. Okay, so in such cases, you might need to explore whether she has the power of attorney. Okay, in cases if Mr. Robert loses his consciousness anytime, okay, then she would have the right to deny that procedure. Okay, now another thing is, whenever we do a procedure, you should also keep and watch whether there's anything life-saving or it's just something in general. Now, in these cases, in this particular case, the procedure that we're going to do is not a life-saving one. Rather, this is a supportive management. Okay, so patient is already in palliative care. So in patients who are in palliative care, remember, we do not do anything aggressive, and we are not going to resuscitate them even if their heart stops. But what we are doing here is a part of the palliative care. So we're going to give him some support by stopping this bleed, because if he loses blood, he's going to be more in pain. Okay, and he's in a lot of pain at this moment. Okay, so sometimes if you have ischemia, it causes pain. Okay, so this patient is bleeding out. So we'll try to support him with this blood transfusion. We tried to do it, but it wasn't successful. So what we need to do, we need to do this procedure, at least to try if we can stop the source of this bleed. And if we are successful, then perhaps it's going to cause our patient more comfort. Now, the introduction wasn't bad. You could have asked about the next of kin. And furthermore, I think you went a bit more that was not inside the scenario, discussing a bit about the surgical options. Okay, so remember that always try to stick to the plan. And in station 4 in general, we'd allow our patient to talk more. And in this case, the patient would be angry at you, but the patient wasn't angry because you told the patient that the procedure is totally pain-free and you didn't discuss the risk involved. Okay, so this in the real scenario, the sister should have a hunch that you are going to do some procedure. She would have heard something, or she wouldn't know already, but you are going to let her know that you are planning for a procedure, and she's going to be very angry at you. That why you are doing a procedure now. Previously, we asked for several procedures, we asked for a surgery, but everyone told us that it's advanced and no procedure will help him. But now, all of a sudden, why you are planning a procedure on him? Okay, so you have to describe it to her that what are the circumstances like and what's her understanding. So when we start this scenario, we check her understanding that how much she knows about Mr. Robert. And she's going to cry to you that my brother, he's in a lot of pain. He has been passing this blood and he has an advanced cancer and we brought him urgently earlier today. Okay, and perhaps I heard that you did a camera test on him. Okay, so what's happening to him and whether he's improving, like how much time he has got. So those kind of questions are going to come up eventually. So you have to say to her that I'm sorry, okay, for what Robert is, passing through. That's his sympathy. So there are times you have to show a lot of sympathy and empathy. In this case, you could have shown more sympathy and empathy. Okay, that means you have to say sorry a number of times to show that you were aware that whatever Mr. Robert is going through, okay, they're of course real, and you acknowledge that. Okay, so to show your acknowledgement, you have to say that we are sorry for what's happening to Robert, and I know it's a very difficult time for you and the entire family. Okay, and we are trying to help Robert as well. And earlier today, when he came here, he was bleeding profusely through his back passage, and we urgently gave him some blood. Okay, alongside we did a camera test to find out the source of this bleed. Unfortunately, okay, we couldn't stop it. Okay, so later our consultant, we have decided to go for a procedure, okay, that could stop this bleeding. Okay, so procedure, yes, we are planning for a procedure. And is there anything running to your mind? Well, doctor, he has been through a lot. And the next question she's going to ask you, so will it require another camera test? I mean, today it was totally uncomfortable for him and you're going to do it again. Okay, will you? So you have to say no. Okay, we are not planning to go for another camera test at this moment, but what we are planning to do, okay, if you allow us, okay, we can discuss it in more details and I can draw it for you. Okay, so always take the liberty or take a chance whenever it allows to draw for the patient whatever you're planning to do. Okay, it's wise. Especially whenever it comes to a procedure, you should always try to draw, and the drawing should be very simple, not something complicated. Okay, so here what you can just do, you can just mention that like this is the stomach, okay, and there are many vessels, all right, there. And what we're going to do, this is a very simple procedure, okay, which is going to be done by an expert. So whenever we discuss any procedure, remember we discuss it like what we are doing before, what we are doing during, and what we are doing after. Okay, so before, during, and after. Okay, so just simple things like before we're going to prepare your brother for this procedure. It's a simple procedure and this is going to be done for his best interest. Okay, so what we're going to do, we're going to pick up a site. Okay, it's usually in the groin. We're going to clean that area. Okay, we're going to maintain proper hygiene. Then we're going to place in a plastic tube, we call it a catheter. It's going to go through the skin and everything will be under imaging guidance. Okay, so we'll make sure that there's minimum injury nearby to nearby organs. Okay, and we're going to insert it into a blood vessel, okay, which is going to go through the through this groin, and through this blood vessel we're going to try to reach the bleeding site. Okay, and once we reach there, we're going to place some chemicals. We're going to inject some chemicals there. Okay, or sometimes some coils are given. Okay, and they're going to stop the bleeding from that site. Okay, and the entire picture we'll be able to see through a monitor. So this is totally under imaging guidance, and this is what we're doing, okay, live, and this is going to be done by an expert as well, okay. And like all procedure, this will also carry some risks, like sometimes there can be an infection, okay, there can be some injury to the nearby organs, but like we said, it's going to be done by an expert, and we could also give some medications beforehand, okay. And of course, it can cause some pain. That will be the main worry of the system. Will it cause any pain? Yes, it may, but we'll try to give him some painkiller. Usually we'll make this side numb with some numbing agent. Okay. So then she's going to object to you that if you could, numb it, then why is crying out of pain all morning? Even the camera test you have done right after it, he has been crying a lot and we cannot take it anymore. He's crying. He's crying out of pain. Okay. So again, you have to show your sympathy. We are very sorry. Okay. For what Robert is suffering from, and we are looking into it. We're trying to keep him pain-free. No, doctor, you should be giving him more morphine. That's when she's going to ask you that give him more morphine. Any reason why you wish him to get more morphine? So if remember always that the medical team decides always what's best for our patient, but sometimes if the patient's relative they suggest any treatment, of course, maybe they have seen such condition before or they know something about it and they might want to tell you something. So that's a clue. Okay, so that's a verbal cue. So you have to explore any reason why you wish to give him more morphine. Okay, anyone told you about anything? So she's going to open up then. All right, I know that morphine can ease pain, okay, and it can also put him to sleep. Okay, so why don't you give him more morphine? He has been trying all along, and he also back at home, he has been having this pain. The painkillers you give, they're not enough, okay, to control his pain. And then you have to say that whenever we give painkiller, we always assess the benefit versus the risk. And we maintain a dose that's for the patient's best interest, because a much higher dose will do him more harm than good. Okay. And she will tell you then, why don't you give a high dose that can put him to sleep forever? Okay. So at that point, you have to object. You have to say that I'm really sorry that this thought came to your mind, but we are legally, we never assist someone, we never put someone, okay, to sleep completely with this kind of medication. It can even lead to death, okay, and this is completely illegal. We do not assist in the death of someone. Rather, we're going to keep supporting him and we're going to try to make him pain-free and get him out of his distress, okay, and this is a part of our plan of management to support him to reduce his distress a bit. Okay, so if you are successful, if this procedure goes well, okay, then we might be able to stop this bleed and maybe it's going to reduce his pain a bit. Okay, we're not sure about it, so don't promise anything in this kind of terminal patient. Okay, like it's totally pain-free. Okay, the examiners are not going to like it, so you have to be very careful and watch your words that, well, this procedure can cause pain, but usually we numb that area. Okay, so patients usually don't feel much pain. And this procedure, whatever the risk, the benefits are way high. Okay, once we will be able to stop this bleed, okay, he is going to be feeling more comfortable. Or else, okay, we might need to also keep giving him blood. Okay, and at one point he will bleed out and he will have more pain. Okay, loss of blood can cause him more pain, okay, in the tummy. Okay, so this is a supportive management. So if she asks you, will it prolong his life? Well, this is not a life-saving procedure, but this is going to keep him more comfortable. This is going to make him more comfortable. This is a supportive procedure that's going to like lessen his distresses, make him more comfortable. Okay, and if we do not do it at this moment, we will not be able to control the source of the bleed. Okay, and he might bleed out and he might not have a dignified death. Okay, so this is what we can do. So remember, this is not a life-saving procedure at the moment, but a supportive one. Okay, and you have to make it very clear to her, because she will try to trick you, and she'll try to make you sound like this is a completely pain-free procedure, or this is a life-saving one. Okay, and if you say it's a life-saving one, she's again going to get angry and tell you, no, why you are doing this procedure, it's not all right, sorry, if you say it's not a life-saving one, she's again going to get angry and tell you that why you're doing this if it's not a life-saving one. We don't want this procedure. Okay. And at such times, you have to ask if she has the power of attorney and whether, Robert has any like wishes in place. And of course, you have to let her know that for this procedure, we need a consent. Okay. And we'll talk about this with Mr. Robert, and he will have every right to deny this procedure even before it started. So he will always have the right to deny it at any point, even before the starting of this procedure. Okay, so you have to make her know that. And furthermore, like you can ask her if she has any other concerns. Now, we discussed the procedure, like what happened before, what happened during. You can also tell that after the procedure, we'll also observe him for any complication. Okay, though there would be very little. And moreover, if it's successful, he's going to be feeling more comfortable than he's now. Perhaps the pain will also reduce. Okay, so in this way, you have to deal with her. Okay, while discussing the procedure, but you should mention about the consent. Okay, and if she denies it, if she tells you no, I will not let you do this procedure, okay, you cannot get into an argument. You cannot tell her that no, you don't have the right. Robert still has the capacity. You can gently ask if Mr. Robert has placed any power of attorney, whether she has the power of attorney. You can just know it from her. If she says no, I don't have the power of attorney, no need to escalate this any further. Just gently tell her, we'll again discuss this with your brother. He still has the capacity. So she can object. No, my brother cannot have the capacity. He is quite confused now. He has been through a lot. He will not be able to make the right decision. So tell her clearly that we will check his capacity. And if it appears that he does not have the capacity in such circumstances, okay, the medical team will take the best decision for his best interest. Okay. So we'll gently talk with her, and if it comes to a term like she is very angry and she doesn't agree with you at all, you offer your senior's help. Okay, so this is what you do to let her know about the procedure in place. You discuss it with her and tell her about the consent that you need from Mr. Robert. Okay, and if she denies, you try to gather about the power of attorney. Just know it, okay, from her, and tell her that this is not a life-saving procedure, but something that needs to be done to stop the bleed, and this will make Robert more comfortable. So this is a palliative care procedure. It's a part of the supportive care, not a life-saving one. And then if time allows, you can go to the social. Okay, you can ask like how Mr. Robert is doing managing at home. Okay, and whether he needs to take care of someone, because when someone you bring in the hospital, they might have someone to look after back at home, maybe a dog or cat, perhaps, or someone disabled. So you just take an account like whether Mr. Robert was taking care of someone, and in his absence, if anyone needs to take care of him, if there is anyone, then that's fine. If not, you can arrange for some social care for that individual. Okay, even if it's a pet. Okay, and you can also provide some support to our surrogate. Always also try to provide support to the surrogate, like, do you need any help? I know you are having a lot at this time, and she's going to open up to you at some point that she had her mother passed away recently. Okay, so it's a lot of blow on one at a time, and they're struggling to deal with all this bad news, and they don't want to see anyone suffering more. That's why she wants the death of her brother. Okay, she just doesn't want Mr. Robert to suffer any further. Okay, that's why she would have wanted you to give this morphine at a high dose, and so that you can put him to sleep. And you objected to that. So that's how you're going to get done with this scenario. Now, pitfalls in this case is sometimes you brought a bit about the surgery. Okay, Alia, no need to explain it. She's already, the patient is already in palliative care. He has been on it for 4 weeks. Okay, so he is being seen by the Macmillan nurses, the supportive care, and they are trying to reduce his pain. But sometimes when the cancer is advanced, there can be different kinds of pain. It can be metastatic pain, it can be bowel pain, it can be adhesion pain, there can be obstruction. Okay, so there are various kinds of pain there, and they would need different kinds of medication. All right, so the medical team, the pain management team is doing their best. They are trying to help your brother, and we'll look forward to it. Since you mentioned this, of course we're going to look into it, but we cannot give him more morphine. And this is going to be decided by the medical team for his best interest. We always watch the benefits and, weigh this with the risk. Okay, too much morphine can do him more harm than good. That's why we're going to do him what's going to just cure his pain, but will not harm him. So that's on the medical team. The sister, she cannot ask for it. Okay, so Dr. Harris, I hope the feedback helps a bit, okay, with your approach and the way you can discuss it.
Thank you so much. Thank you so much. Yeah.
All right. So if you are asked about the legal issues in this case, remember, one of the legal issues would be euthanasia. That's illegal in the UK, and that would be asked by the surrogate here. The assisted death, it's completely illegal, and you can say it to her. Okay. Remember that time is limited, only 14 minutes, and within 12 minutes you have to get completed with your task, right? So you have to watch your time. And a wise man, there are many wise men here, okay, many mentors, and all will say one thing, even it's written in the writer, that in station 4, the less you talk, the better. So let the patient talk more. And the more you show your sympathy and empathy, the more marks you are scoring, because that's what the examiners love. Okay.
Can I ask one thing? Sorry,
yes, please.
You.
Go ahead.
When I was trying to explain the procedure to the surrogate, and I did not explain the complications, I might have come to it, but she broke me halfway in whenever I was trying to explain. And like you said, I was trying to give her more time. And throughout those 14 minutes, she continually asked me her concerns. So how can I incorporate this capacity, consent, and this complications things if I am unable to do so, because I'm just following her chain of questions just to trying to answer all the concerns that she's having. So I found a bit tricky to do that. Do you have any suggestions for that?
Of course.
And I know it's very important to incorporate the complications of the procedure. I totally get that. But because she was asking me and cutting me halfway when I was trying to explain the things, what should I do in the real time, in the exam itself?
All right. So one trick that we use sometimes, like here, you are not giving any bad news, nor you are talking about you're just discussing a procedure here, right? Sometimes you will have to break a bad news, and that would also involve discussing a procedure at times. Okay. So there can be two tasks in some scenarios as well. Okay. And sometimes you have to deal with an angry patient, and many times you'd want to tell the patient something very important, right? So like here, that's why the first thing would be, what would be wise to limit your discussion. Number one, not to bring anything outside the scenario initially. And if it happens like the surrogate is keep on interrupting you, okay, like cut you in the middle, it will happen. That's their task, okay, and that's they're really good at. Okay, so what you do, you have to come back to it by saying, so can we discuss something very important? Okay, and if you say this, they're going to give you more attention. But make sure when you say it, you can just say it once. Okay, and if you say, if they are focusing more on you now, okay, you have to get done with it. Like if you wish to say that you feel like something very important is remaining that you didn't touch, that's the time when you have to finish it. Okay, so you have to discuss like this, like if it's all right, can we discuss something very important about Mr. Robert? And you have to change your tone a bit, and they will say, okay, what's that important? So this procedure is very important in the sense it's going to make him more comfortable, and though it has many complications, though it has many risks, okay, the benefits are way high. Okay, so would you like to know the risk? Okay, in this way you can invite her to know the risk, and if she doesn't want to, that's one way to get over it. Okay, if she says no, I don't want to hear the risk, totally this procedure is not needed, so in such case you will get a safe passage that you offered, but she denied to know more. Okay, it's our will, and the way you stuck to the patient's concern, that's okay. You should be sticking to the patient's concern. Okay, don't make it like you are fulfilling only your agenda. The way you stuck with the patient's concern, that is okay. Okay, sometimes some patients are angry, so maybe you have some task, and if the patient is angry, the examiners will also notice it's not always possible to fulfill all the tasks, even touch the social in such cases. Okay, so there was a point you went to summarization. You wanted hard to check. You wanted to check the understanding. Okay, okay. So that's also okay. Whenever you do a procedure, you should always check the understanding at the end. Okay, but make sure that you are done with all the consent. So I think you know the steps of doing this, how to discuss this procedure, and perhaps you didn't write it in your paper because you should have a flow chart on your paper. That's something that I have to touch. If you forget that, whenever you just give a glance in the station 4, you cannot make any notes. But whatever you have written from the outside, you can just have a glance at it. I mean, you can have a look, and it reminds you that, okay, I haven't discussed the risk. I didn't mention the consent. Now, consent would have been very important to mention to her. And if she would have objected, you could ask about power of attorney. Okay, so these are legal issues. And if she didn't have objected, then power of attorney, perhaps at this time, I mean, the examiners might even not mind because Mr. Robert is still allowed. But in these circumstances, they would expect you to give it a touch. Okay, some examiners would expect you to give it a touch. And remember that station 4s, they are seen in humans' perspective, like the examiners are human as well. Okay, so they're going to, like, before you, there will be 4 more examinees, or after you, there'll be 4 more examinees. So if you are starting this case, maybe you're the first one. So the examiners won't be too much judgmental on you. But if you're the 5th person, 4 other candidates have done it before you, and they could manage it well, much better than you. Of course, a part of their judgment would be clouded, and they would give you less mark than the ones who have come to you before. They would think that, okay, so all of them could touch this, why this candidate couldn't. Okay, so they're humans. So that's why the marks vary. Sometimes one examiner gives you satisfactory, the other examiner gives you borderline. Okay, I have seen many feedbacks like that. Okay, it does happen. So what you need to do, you need to ensure that you touch all of your tasks, and you try to give most of the important information. At the same time, you kept a balance between hope and despair. Do not give some hope, like you say, it's totally painless. Okay. And I mean, sometimes if you give a false info, they're going to mark you badly. Rather be honest that the pain, I mean, all procedures, it can cause some pain, but we try to keep it to the minimum. We're going to use some numbing agent. Okay. Like in this case, we use some numbing agent. Okay. You can say, or you try to keep the pain less, or giving some painkillers. If you do not know how exactly the procedure is done, in general, you can say we need to give some painkillers to reduce the pain. Okay. But this procedure, like all procedures, there are some risks. And this is bleeding, infection, injury to the nearby organs. It's common to all procedures. Okay. So if she wishes to know about the risk, you can invite her at that time. If you're running out of time, then would you like to know the risk? If she wishes to, then mention it to her. If not, then you carry on further. Okay. So this is how at times you can, take the flow and complete the task that's you feel like is still left undone. Okay. And be careful about the jargons. So I think if you practice more, you know how to do it. Okay. Just stick to the scenario. Don't use any jargon, and show more sympathy and empathy. And inshallah, you'll be in good terms with the patient. Okay.
Okay. Thank you so much. Thank you.
All right. So do you have any other concern related to this case?
Assalamu alaikum.
Wa alaikum assalam, Dr. Hashim. How are you?
I'm fine, sir. Thank you, sir. How are you doing?
Alhamdulillah, good as well.
So if sister is asking that is this a life-saving procedure, and we said it is not a life-saving procedure, then does she has the right to deny the procedure? She will say, like, then it's better not perform this procedure on her. He's already suffering.
All right. So I got you. Okay. So usually there are some life-saving procedures, like when we do the CPR, resuscitation. Okay. Sometimes tracheostomy. Okay. So life-saving procedures means if you do not do them right away, the patient is going to die within seconds. Okay, so such procedures are to be done on patients who are well. Now, even if this patient dies now, let's say the heart stops, you're not going to resuscitate him because he's already in palliative care. He's someone who is going to die. Okay, terminal patient. All right. Now, he is bleeding out, and the procedure that we have decided to do, this is to stop the bleeding. Now, in these cases, if you need to do a procedure, you definitely need a consent. Okay, and this consent has to be from the patient. And if our patient loses the capacity, then we ask for any power of attorney. Now, any power of attorney, they can deny any procedures except a life-saving one. Okay, because life-saving procedures, the decision is usually taken by the medical team. But there is also some exception. Sometimes it has to be written, like when a patient makes a living will or decides to make someone or appoint someone the power of attorney, they can mention that this person, I give him the right to even deny a life-saving procedure. So if you had a different case, let's say, and the patient didn't have any comorbidities, like let's say a patient was completely okay and suddenly had an accident, okay, and there was a big hematoma there. There's a case like this in Ryder, and now you turn up with the wife, and maybe the person left the wife or appointed the wife as a power of attorney. Okay, imagine that. So in such case, now you're going to do a surgery to do a bar hole or remove that hematoma, and you need a consent to go for this procedure. So of course, you're going to look for if the patient has left any power of attorney and whether the patient has any advance wishes in place. Usually, unless the patient has a comorbid condition or a progressive disorder, usually they do not leave such thing. But if, for instance, the patient has one in place, you should explore that, okay? And you find out that the wife has the power of attorney. So you ask her that we're going to go for this procedure, okay? And this is a life-saving one. If you don't do it, your husband dies. Now, if the wife objects at that time, okay, then you ask the wife, did your husband give you the power of attorney to object a life-saving procedure? So that's something you need, together. So denying any procedure, that's the usual, role, that can be played by a power of attorney. They can deny any procedure, but not a life-saving one. For life-saving procedure, you need a special, clause in the power of attorney, okay? Like you should be given this power to deny life-saving procedure. So you should always explore that whether this power has been given to the patient's relative, the power of attorney, to deny even a life-saving procedure. If she has that, then she can deny. Now, the medical team is not going to give away. In such cases, the medical team can go to the court of protection to overrule this power of attorney. These are just legal stuff, okay? Usually, you don't have such a case in the exam, but if it comes out or turns out that you come up with a patient's relative who has even the right to deny life-saving procedure, then you have to agree and to that surrogate or relative, because she has the right to deny even a life-saving procedure. So you should explore for it extra, differently. That do you have that as well? Okay. I hope I made myself clear, Dr. Hashim.
Thank you. So one more concern, sir, regarding the scenario. It's clearly written that you're talking to a sister. So we wouldn't ask her that she's the next of kin, isn't it? We know that she's a sister as per the scenario. We should not ask, is she the next of kin?
No, you should ask, because next of kin does not necessarily mean that it has to be the sister. It can also be a friend. Okay. So in UK, all of them carry a card. It can be in the wallet. Okay. They can be carrying it in the pocket as well. It's mentioned that someone that they have chosen to be their next of kin. So the next of kin has no power but to listen that the updates on the patient. So if you say like you have 4 brothers and 4 sisters, and you also have your parents. So you choose your little sister to be your next of kin because you trust her more, and you know that she's going to take any like bad news. Okay, she's rough and tough, so she's going to absorb it better than your other siblings. She's not going to have a major breakdown. So you choose him, or so choose her to be your next of kin. So next of kin has to be chosen by the patient prior. Okay, so that's why you always ask, like, whether he or she is the next of kin. And if it turns out that your surrogate is not the next of kin, you can just look at the examiner and say that my surrogate is not the next of kin. Should I continue? If the examiner gives a good go, you go. Okay, but that usually do not happen. Most of the time, the surrogate says that yes, I'm the next of kin, or it's mentioned from the outside that the person you will be talking to is the next of kin. Okay, so it goes like that. But you should ask, because many feedbacks, 10 to 20 feedbacks we have seen, and we have shown you before as well, that the first thing that note is whether you mention the NOK, next of kin, because this is something you should check.
Okay, thank you.
All right.
Doctor?
Yes. Yes, please.
Doctor, we didn't understand if she has a last power of attorney. She has a right to refuse the procedure or no?
This one, if she has the lasting power of attorney, for this case, let's say the patient loses the capacity, yes, she has the right to deny this procedure because it's not a life-saving one.
And if it is life-saving?
If it's a life-saving, then not. Then the medical team decides what's best for the patient. But you have to ask whether she has this extra power to deny even the life-saving procedures. These are legal powers, okay? One being stronger than the others.
Okay, thank you.
Doctor, I have a few questions. Can I please ask?
Sure, go ahead.
My first question is, you said like to ask whether the surrogate is next of kin. What if the surrogate says, no, I'm not the next of kin? Should we continue, or what we should do in that situation?
In such situation, you go to the examiner, you just tell the examiner that my surrogate is not the next of kin. Should I continue? And the examiner will give you a go. Usually that never happens. Like I said, always they will be the next of kin, but you should always ask. Okay?
Right. And my second question is, like, is there any place where euthanasia is like legal?
In some parts of the world, euthanasia is legal, but not in UK. So I currently don't know. I heard perhaps in New Zealand, perhaps. I mean, there are some places. There are lots of movies on euthanasia.
Right.
So, that's not for UK. It's illegal.
Right. And lastly, if you can please explain once again what we have to do during the procedure. I couldn't like catch it.
Oh, this is a transarterial immobilization. So you just simply say that this is a procedure which we are doing. Always explain the purpose of the procedure. This is a procedure that we are going to do to control the bleed, and it's a part of our supportive care. Okay, so what we are going to do before the procedure, we're going to prepare your brother for it, and we are going to pick a site. Usually it's done to the groin. Okay, and we're going to clean it with proper hygiene. We're going to numb that area so that he doesn't feel much pain. And this is going to be done by an expert who has done this many times and under imaging guidance, so that the chances of any injury to nearby organs are low. So in one case, in one sentence, you're explaining to the patient that we are also trying to avoid any complication in play. I mean, that can happen. Okay. So we put in a plastic tube, which we call a catheter. It's passed through the skin and it's inserted through a vessel, and this reaches the site of the bleed. Okay, it's advanced slowly, and when it reaches the site of the bleed, we place a chemical or sometimes a coil, and it blocks the bleed or stops the bleed. Okay.
Right.
And that's it. And that's it. Okay. Then we bring out the tube and we seal it. We give a bandage or we seal that area, and we observe your like always at the end, we observe our patient for any complication. And if this process is successful, if this procedure is successful, okay, your brother will be more comfortable. Okay, then he's now, and he will not need and he will not lose any further bloods. Okay. All right.
Right, doctor.
And for
Thank
this
you.
procedure, we are going to need his consent. So we're going to discuss this with him again. All right. So this is how
Right.
you
Thank
discuss a
you.
procedure. All right.
Thank you
So
so much.
thank you, Dr. Harris, for taking up the case.